Wellness Wednesday, and Doug mainly is going to talk about the very important factor of how can we gain weight and why is the reason that the insulin spikes. Where is the insulin being produced? In the pancreas, right?
In the pancreas. Insulin is produced in the pancreas to help uptake blood sugar that's coming out in the blood. And glucagon, also secreted from the pancreas, helps when you have too much of that response, and it helps to release the sugar. That it improves that part of the blood sugar as well. So, you know, the big question people have to ask, what's the actual need or want for what's the right level, I should say, of blood sugar? And, you know, we're taught different general scopes of what it is. New standards have seen less than 100, basically, is our goal for not having diabetes, not having any major issues, and being able to maintain that on a fasting level, which is really what we kind of see first thing in the morning. And then between 100 to 126, we see kind of a diabetic type of standard, or an insulin resistance, we would call it, patient, where we have that, anything above 126 fasting, we do consider, on multiple occasions, we would consider as a diabetic. So focusing on those levels in a fasting state, how does the body work? So basically you want to make sure that we get as much of that sugar utilized appropriately, right?
That's correct.
So when
there is timing for that as well, proper timing for taking the proper sugar. But then again, you know, like for example, we talked about many times, and from the exercise standpoint, post-workout is very important to make sure that you're going to consume some kind of sugar. Last week I had a post about that. You want to consume some dextrose, some glucose, some sucrose. Those can actually help you to shove all the nutrients, what you take in post-workout, into your bloodstream. So because of that, it's going to help you to repair yourself, so you're going to be able to recover faster. But if you just eat a banana, what is it going to do? It's going to do an insulin spike to their body, and it's a one-way street, unfortunately, because it causes all sorts of hormonal chain reactions.
Correct.
And enzymes are being produced, or rather, on certain enzymes are not being produced because due to the insulin, and what happens is your body's going to start to store the fat. Whatever it cannot utilize and store it as a glycogen in your muscle tissue, in your liver, then it's going to shove it into your fat cells.
So the big thing to remember, when we have insulin spikes, as we call it, when they're not even keel, you tend to actually get more hungry. Your appetite goes up. So that's why we tend to see patients who are hungrier, they tend to want to eat more sugar, and then they end up having higher insulin spikes. It's kind of this wicked circle.
Absolutely. So it's actually signaling to the brain as well, right, Doc? So it's constantly messing with your head. If you're constantly consuming some kind of simple carbs, and especially there is no dietary fiber, there is no protein with that same meal, which takes so much more time to digest.
Or healthy fats.
Or healthy fats, exactly. Then your body is going to be has to rely on the insulin levels, and it's going to constantly be elevated.
Right. So you do need some sugar, and we're not saying you shouldn't have that. That's the whole point of this, is that you need an appropriate amount of sugar, but making sure you balance it appropriately with a good amount of fiber, protein, or healthy fats.
Yeah, so it's nowadays very simply put, why is the obesity so epidemic? Is because nowadays, unfortunately, fibers are taken out from our meals, and dietary fats are being increased.
Correct.
And unfortunately, protein are still very minimally being utilized.
Right. And some patients that I have that I speak to say, I don't need the carbs, it's fine. Well, I mean, some metabolisms they can handle having very, very little carbohydrate in their diet, and that's appropriate, and maybe they want to shift to using a different source, such as protein or good fats as their burning source. But we know physiologically, carbohydrates are not evil. It just has to be utilized in the appropriate amounts.
Doc said it so perfectly. We are not talking against carbohydrates utilization. You want to make sure you use the carbohydrates properly. We are not saying that carbohydrates are going to make you fat. Anything where you're creating a surplus, it can be even protein, because at the end of the day, if nothing else existing, protein is going to be creating blood sugar spike as well.
Exactly, it turns into complex carbohydrates. So
and if everything else is existing next to protein can make you fat as well.
Absolutely, so, too much of it.
Yes, too much of it. So basically, simply put, what do we need to focus on, Doc, when we don't want to spike the insulin?
So you want to make sure that you have an appropriate amount of the appropriate carbohydrate, but mix it and utilize it with the either fiber and or protein and or healthy fats in appropriate amounts, because you want to utilize the body to not have too much of one thing and not enough of the other, and therefore won't have a spike of that insulin in the end.
And how do you know how much you need? Talk to us. Exercise medicine, guys.
Nutrition is the key.
That was